So I think a lot of people have heard the word harm reduction in the context of drug use, right, and the overdose crisis. But harm reduction is sort of literally exactly what those words mean. It means sort of in a health context, anytime you're doing something risky, which being a human moving through the world is just inherently risky, right? How do you mitigate that risk? How do you reduce the potential harms to just living and moving through the world? So I think it's important to understand harm reduction as something all of us do every single day, from wearing sunscreen, wearing a bike helmet when you bike, right? But within the context of drug use, it has both that connotation, right? How do people who use drugs keep themselves safer from the negative health outcomes associated with using drugs? But it's also a political movement. It's also an advocacy movement that really was driven by people who use drugs and the communities and people who love them in a time in this country, which continues to today, when those communities are severely marginalized, right, and punished for being who they are. And so we sort of think about harm reduction at CDPH as both things like fentanyl test strips, xylazine test strips, Narcan. How do we keep people safe from overdose, keep people safer when they're using, but also how do we support this advocacy movement that is really saying, no, people who use drugs are human. People who use drugs need care and support in our communities. So we think about non-judgmental, non-coercive provision of services. We think about how we engage the community, thinking about low barrier services and health equity in everything that we do.